I'm Dorothy.
Corey.
I'm Julie.
And today we will be talking about generalized anxiety disorder. Generalized anxiety disorder is a physiological and psychological disorder that affects us. About 30% of women of our country's population and 19% of men are affected with some type of generalized anxiety disorder. The physiological effects are heart palpitations, profuse sweating, muscle tension, fatigue, and even nausea. And then our psychological effects, someone can be very worried about a common situation that occurs and be overly frightened about that, such as a large crowd or going into a new situation that they're unfamiliar with. And every individual exhibits anxiety differently. Children can say that their stomachs hurt, they have butterflies in their stomach, sometimes they have to urinate often, their hands are shaky, and they can also cry often if they're anxious. And then other symptoms could include difficulty sleeping, impaired concentration, and dizziness.
Hi, I'm going to talk about the assessment scales. So we have a scale called SCARED for children. It's called Screen for Child Anxiety-Related Disorders, and it measures anxiety and somatic systems, and it's filled out by parents. It has 41 questions on it, and the total score of greater than 25 would indicate that they have some form of anxiety, whether it's anxiety disorder, separation anxiety, social anxiety disorder, significant school avoidance. So this is a really very good screen. The next screen I want to talk about is the Beck, right here, Beck Anxiety Inventory. It measures anxiety as well as somatic symptoms, and it was developed by Aaron Beck, and it's a self-report system on anxiety, and that is very commonly used. So the scores range from 0 to 3 with no anxiety, 10 to 18 mild anxiety, 19 to 29 moderate, and 30 to 63 is severe anxiety, which is a bit of a problem. We also have the Hamilton scale, which is another self-reporting scale. Actually, I'm sorry, that's not a self-reporting scale. That is the clinician helps with that, and you have to be trained to fill out that. And then we have the general anxiety scale, which is just a form that you fill out yourself.
Okay, so today I'm going to be talking about OT treatments. So for anxiety, we want to introduce coping skills to clients dealing with anxiety to reduce those thoughts of worry and distress, and also reframe their thinking patterns so they have more positive thoughts about the environment that they're in and how they're feeling. And also we would want to implement thought stopping, which is used to stop negative thoughts from affecting functioning and to decrease signs of anxiety. For our second OT treatment, we would utilize motivational interviewing. So this would include the therapeutic relationship between the therapist and the client. And this is a client-centered approach to reduce one's worry with a focus on empathy, evocation, and support for a patient's autonomy. And this will go over strategies when to develop discrepancies between patients' current and valued selves.
Now I want to talk a little bit about practice settings. So we have schools, prisons, and holistic healing centers. Well, they're all very different settings. So schools, children spend 8, possibly 10 hours a day in schools. So they really have a lot to do with coaches and teachers. And so it's important to control a child's anxiety in school as well. So there's counselors and teachers are all trained to help children with anxiety. So it's very important that we really look at the population in elementary, middle, and high schools. The next is prisons. So a lot of our mental health population reside in prisons. So it's important that they get treatment so that when they get out into the world, they can have coping strategies. A lot of prison inmates will say that they actually like to be in prison because they don't have to worry about food, shelter, clothing, all of those kinds of things. So dealing with anxiety in prison is very important to manage skills. And the last is a holistic healing center. Now, we chose a holistic healing center because it has a very calming effect on people, and some people have white coat syndrome. When they get in a clinical setting, they get very nervous. So a holistic healing center will have group therapy, meditation, yoga, many different modalities to try to calm the person's anxiety.
Okay, so for group treatments, when we look at the different practice settings we have, what we want to implement are different treatments for our clients. So our first one is play-based therapy, which will reduce anxiety in children when they're put into new situations. So play-based therapy is a group therapy session with other children going through the same process and will help children relate to others and in turn reduce their anxiety. So the social setting with other kids will help them to alleviate their signs and symptoms of feeling anxious. Our second group therapy would be the implementation of group yoga and meditation classes. Yogic breathing will be introduced to reduce stress, which has shown positive results in reducing signs and symptoms of anxiety. And this treatment could take place at a holistic center, school, or
The
prison.
last one is cognitive behavior therapy. Individuals suffering from anxiety will work in small groups with peers to learn new coping skills. CBT can be used in schools, in prison settings, and in holistic healing centers. CBT has been shown to decrease the symptoms and feelings of anxiety. And treatments would include image exposure, progressive muscle relaxation, cognitive self-monitoring and restructuring, relapse prevention strategies, and psychoeducation about worry and anxiety. In schools, an OT could work with students and work on finding out the best time for going into the hallway to go to the lockers so they're not worried about the environment of too many kids being around, if that is something that causes anxiety in high school children, or even middle school and elementary school sometimes have to go to lockers too. And then, okay, I think I can almost end it. So CBT intervention strategies would include adaptive coping skills, relaxation techniques, and social problem solving skills, which as OTs we would be able to provide to all of our clients in all the different settings provided.